have enough immune system. They don't have the psychological, absorber to hold what is ongoing. Some of them don't even know why they are into the war they are undergoing.
Is that why they say children are more affected than adults?
Exactly. They have more because they are dependent. They're a vulnerable population. They don't have the psychological, the mental, the emotional to withstand what's going on. Some of them don't even know what is going on. So that's it. But it's unfortunate that I'm by now expecting some major sanctions, to have come into play, as far as these areas are concerned. Yes, we have it going on in Ukraine, in Russia, and all of that. But it's also we have it all the local.
One case in point is yes, we know you're having problems, you're having clashes and all that, but should that stop or even impede the EPI, the administering of vaccinations in those areas? Shouldn't they allow for such things?
It's a pure violation of human rights, because every human being, in fact, health is a fundamental human right. Come what may. So, and there are memorandum of understanding that protects the rights of everyone to health services. So it shouldn't be. And I think if you go back to the history of the war ongoing, even the Gaza and Israel, you discover that one of the reasons why there was an alleged case whereby some individual felt that the opposition had to go and hide in hospital buildings, to launch the attack, because they knew that there is something that is covering, access. There's a protection for hospitals, for access to healthcare. So, and that's why, these people plan their strategy, allegedly, to be able to launch out from there.
And that thing has just taken the war to another dimension.
Exactly. So I think they explore that treaty. The treaty is there. It should have been respected. The oppositions, they also know about this, and that's why they planned their attack.
But do we have this treaty in Nigeria? Do we recognize it in this country?
Nigeria is blessed with abundant laws, memorandum of understandings, and all of that. But the implementation of all this is what we have problems with. We have not been seeing much of this happening, in areas, displaced spaces, in the north, even in the south. We've not been seeing that taking place. So I think we need to come out as a government, to be able to implement all of these things, to first of all, to increase their awareness. That health is a fundamental human right. No matter what is ongoing, you must allow access to health services, no matter what is ongoing. So, but in Nigeria, going back to all the history of communal clashes we've had, the kidnappings and all of that, we've not been seeing this thing happening. And the right sanctions also have not been coming down.
Okay,
to people.
So there are so many other challenges to access to health, which I'm going to ask you to mention, but I want to bring out one. Giving birth to this one, are these crisis situations, is the IDP camps, the people who are displaced.
That's right.
They are human beings.
That's right.
They just don't have homes anymore, or they don't have homes yet. How are we doing with the IDPs?
Well, we can do better as a country. There's a lot of attention going on, but I believe we can do better. We've had cases allegedly where materials are meant for IDPs are looted by the officials. Are made available. Yeah, they might be available to. So some degree of attention is going, but we believe we can do better. We've seen international organizations like Red Cross Society, WHO, UNICEF coming to help, setting up a structure, of health services in the IDPs, where they have access, to medical practitioners. They have access to vaccination to prevent outbreak within the IDPs. They have isolation areas. They have access to water and all of that. They have access to food. But what is the quality of food that these people have access to?
Let me even take it a bit out of the arena of the patient himself. As a medical officer, what quality of protection do you get going to conflict zones?
Exactly.
In Nigeria.
Exactly. That's another thing we need to look at, because you may want to link that up with the current movement, migration of medical practitioners, outside the country, because we are not getting enough protection, not only in conflict areas, even right there, in areas that are more stable. You know, in private hospitals, in government hospitals, you see abuses, you see insults. There have been cases of where doctors have been stabbed. In the hospital, in the consulting room.
Why would anybody stab a doctor?
Exactly. So no protection for the
but
doctor.
Really, I mean, I'm actually asking why.
So the laws are there, but then
a patient that is not happy with the result,
just happy with the result, or not happy with the way the doctor, is attending to them. Of course, the doctors are overwhelmed.
And where do they get the knives?
Exactly. So everything boils down to security. In our hospital facilities, do we have enough adequate security? Because how could our clients or patients come with those kind of ammunition into a consulting room? So these are all questions. So doctors are not being protected enough, not only in conflict areas, but then we have the worst case scenario in conflict areas where those who are there, they're also victims of the kidnappings, a victim of the shootings and all of that. No protection, for it. And that's why you are seeing less specialized practitioners in those areas. What you have is ad hoc staff. What you have is people who have been trained, paramedicals, someone who have an idea of first aid. Those are the majority of the kind of people you find those are, because you don't want to risk your life, as a professional, as a core professional. So this is affecting us, but the protection is not really there, both in conflict areas and even in the most stable
I know
areas.
that there are other challenges, but let's switch gears. Let's hear something good. Where have we got it right with access?
Okay.
Or have we got it right anyway?
We have to a certain extent, because right now we're talking about universal health coverage, and if we want to go back to Nigeria and even to some other states in Nigeria, I want to talk about health insurance that is doing well now. The story of Nasarawa comes to my mind.
Nasarawa?
Yeah, Nasarawa comes to my mind.
Tell me about that.
Lagos State is also doing well too on the issue of health insurance. I think they've been able to leverage on the 1% federal government consolidation, which is the Basic Care Provision Fund. They've been able to judiciously assess the fund and to judiciously also spend the fund.
But many in Lagos State, I know, are not on health insurance. How do you capture what do they call them, informal sector?
Yes. Well, the Lagos is not doing badly. If you look at where they started from and where they are now, they're not doing badly, but they can do better. So I think the number is increasing. Recently, last month, celebrated, I think, 1 million enrollee, in Lagos State, and I'm sure between that time and now,
1 million, okay.
Between that and now, the scale up, and that across both the public sector and the formal sector. But I think a lot still needs to be done, to capture, those who are working at the informal sector, to bring them on board into the essential. So in the area of health insurance, I think this is one area we've been able to bridge the gap as far as access to healthcare in Nigeria, in Lagos State, and some other states in the country. Not only that, we want to talk about our personnel. I think comparatively among African nations, and even comparatively between Nigeria and other nations across the world, I think we are not doing badly in terms of personnel. Yes, we have some degree of imbalance when it comes to doctors. If you look at our doctor-patient ratio, it's abysmal. But if you look at the whole health workforce, holistically, it's not bad. I'm beginning to get some feedback from Canada, from other countries, whereby to even book an appointment to see a doctor is a problem. In fact, one of a family friend gave me a chat recently, and told me that I was in the hospital for a whole day and I couldn't see a doctor. Not that I broke an appointment. I came at the day I was appointed to come, and yet I could not see a doctor for a whole day.
And what did he attribute that to? What was the problem?
So inadequate personnel. So Lagos, Nigeria, compared to other countries, we are not doing bad in terms of recruitment of personnel, training of personnel, but I believe that we can do better. So this is another area we are getting it right, to reduce out-of-pocket payments, then also to increase our personnel. There's another thing that is ongoing right now to also increase the awareness on tax shifting and tax sharing. That's also ongoing.
What's tax shifting?
Where is a protocol whereby you have members, other cadres in the health system also taking up some roles, that another cadre would have done, but because there's inadequacy.
That is just another word for multitasking.
Exactly. So that's also ongoing, and I think that has helped to bridge the gap too. So that's another area we've gotten it right. Some degree of infrastructure is ongoing, though at the rural area it's not yet good. We can do better, but at the urban areas you see a lot of communication roles now that is bridging the gap, so that we can have reduction in our maternal mortality. So that's ongoing. So we have some states who did well, who are also doing well in providing in that means of transportation. So that is also another way to bridge the issue of access gap. Power, we've not really done so well in terms of power. I believe we can do more.
Yeah, that's another thing. That's essential for people on life support.
Exactly.
It's essential for the cold chain of vaccines.
Exactly. The emergency services also require some degree of power.
Well, I thought there was this public-private partnership when it came to power to make sure power is always there.
Yes, the public-private partnership is ongoing, both at the state, federal, state, and local level. Even within our hospitals, there's this public-private partnership. But then we need that partnership to become more robust. We've seen movements of influx of installation of solar. Light supply into our facilities, which has helped.
Just too much sun, not to be on solar energy.
Yeah, we should be.
But let's quickly take a break. We'll go for a very short break. Be with you on the other side. Back. This is Health Matters on Channels Television. We're talking about access to health in Nigeria, and I'm with Dr. Shalom. If you want to speak with him, ask him questions about access to health, the number to call is 0808-054-2233. You can also send a message at CTV_Mary A, or send me email to moalale@channelstv.com. Let me go back to the health insurance for just a bit. There are some people who will not believe that they can walk into a place and get free health care, especially when they don't have a job. How do you convince a person? Because it's one thing to talk on TV, talk on radio. Do you go around the communities and say, if you're sick, you can actually come to hospital? How do you capture those people? Because they have a right to health too.
That's right. So a whole lot of activities are ongoing, and the first thing is stakeholder engagement. There's an ongoing stakeholder engagement across the country, and which is also part of the modus operandi, of the health insurance scheme. So especially in Lagos State. So that is to create awareness for vulnerable peoples in the community and to other individuals who will not believe this, because some degree of public distrust. But then that awareness, that stakeholder engagement is restoring back that confidence that you can actually walk up into an hospital if you have your health insurance and be a beneficiary. And the government is doing something that is fantastic right now. From the 1% federal government consolidated revenue, which is coming through the different gateways, and that is selecting vulnerable people within our communities, and this is ongoing across the 36 states. And using certain criteria to determine vulnerable people and enrolling them freely, for health insurance in a facility that is very close to them. Lashma has done well.
Have any of them come to the hospital for treatment?
Exactly, it's ongoing. Though the utilization needs to improve. But then some degree of, these people are coming into the facility, responding, utilizing services, and they are doing well. So we have the success stories out there, but I believe that the awareness still needs to increase, both for those who qualify to be enrolled and those who have been enrolled. Some people have been enrolled but never knew. Some people have been enrolled, but they just don't believe that they will still work up. So
you see, that's my point.
Exactly. So
they need to know that they can actually come in and not be dissed or thrown out.
Exactly.
What do you mean?
No stigmatization.
You don't have any money.
No discrimination. Exactly. So on the part of the health administrators and even the community members, I think the awareness is increasing. People are beginning to have trust that when we are enrolled, by the government for health insurance, we can actually access this insurance. It's ongoing. Even Lagos, Lagos is doing something fantastic. The palliative ANC, antenatal care, a lot of pregnant women are coming to our hospitals, in the primary care centers, in the general hospitals, and they're getting this free. The success story is,
at least I know that one. I've met one or two.
Exactly.
Okay. WHO says one person dies every 5 seconds.
Exactly.
From indoor and outdoor pollution. That is a frightening statistic.
Exactly.
Do you talk to your patients about this? What are we going to do about this indoor and outdoor pollution?
Well, it's unfortunate. We are currently suffering from global climate change, and it is really impacting on every sector. And one way is, we find ourselves in this situation because there's burning of these fuel fossils, industrialization.
Some people can afford.
Exactly.
But I'm wondering, is it also because of ignorance that some people are doing these things? And maybe they could afford a better form of energy.
Exactly. First of all, the kind of energy that we have access to in Nigeria, it's not helping the climate change, and not only us, but across the globe too. In fact, even in other countries whereby they've signed treaties for clean energy bill, you've seen some of them default also, and they putting blame game among themselves. So, but back in Nigeria, the federal government is doing something that is, interesting now, to move us away, from fossils, from fuel or gasoline into gas, and to see how we can begin to power a lot of our things. So
hang on a minute. Gasoline is different from gas?
It's different. The gas.
What do we use in our homes now? That cylinder, 12 kg. What's that?
So that's liquefied natural gas.
Is that not safe? Is that not good?
Exactly. So that's what we are moving into gradually now. So we are looking at how that one can even power our vehicles. Because right now,
the CNG thing.
Exactly, CNG. I think Ogun State is doing a little bit well on CNG buses now. I think Osun State is joining, or your state is joining also.
People are actually using these things.
It's coming up gradually. So I believe a lot of effort and encouragement needs to come into place, to get all of that done. So once we're able to do that, then we are on our pathway to,
about cooking.
To energy bill. Yes, cooking.
Cook every day.
It needs to become more affordable. To an average Nigerian, to common Nigeria.
And affordable is not what we're about right now.
Exactly. Where to fill a 12 kg, 12.5 kg cylinder, we are paying close to about 14,000 right now. So, and we are still going by the old minimum wage, which is still...
Exactly. I mean, that's being practical.
Exactly.
Some things are just not...
So can an average Nigerian worker afford, to fill a 12.5 kg cylinder? So these are the challenges. But then we are on a pathway. The government needs to, to help to create that atmosphere.
What would be your first suggestions for us to move onto better access to health? Because there's a lot. So how do we start? What are the baby steps we should take in Nigeria?
One of the major factors that is driving lack of access to health is political inaction, lack of funding, and lack of accountability. This is the number one. So what I'm going to suggest right away is that we want to appeal to policymakers, to politicians, to administrators at all levels to bring, to come on board, not paying lip service to healthcare, but actually putting your mouth, your money where your mouth is. For example, let me talk about the Abuja Declaration that talks about 15% of your budget, of your national budget, annual budget. Right now, healthcare in Nigeria does not enjoy 15% national budget yet. So that's some degree of political inaction. So, and that cuts across both federal, states. In fact, there's a counterpart funding that every state is supposed to bring on board to fund healthcare in their states. How many of such states are bringing that counterpart funding? Then, at the local government level, how many of the budget for health, allocated for health, is actually working? That's what we call budget efficiency.
Yes.
It's one thing to have budget allocation.
How well are you using it?
How well is that money that has been allocated for health?
Who is it touching?
Who is it touching at the grassroots there? So this is political, and when we fail at the federal, state, and local level, then it's going to affect, access to health. So I think that we should start from there first of all.
Would you say fake and substandard drugs is affecting access to health?
I believe too, because we have so many proliferation right now. I think we had a head of National Drug, Food and Medical Control one time that was very vibrant, and since that time we've not had it. So we have a lot of proliferation of fake products.
Do you know what happens these days? And it's a tragedy.
Exactly.
Some conditions in some people are harder to treat than others. So maybe somebody has malaria, for example, and has taken medication for one day and is not yet feeling better. Next thing they do is this even original? You know,
exactly.
It's really, really bad for the mind.
Exactly.
To be suspecting your country
exactly
of having fake and substandard drugs.
Exactly. So we need the regulatory bodies also need to come on board, and like I said to you, it also go back to political inaction. You know, we talk about political inaction in terms of funding. There's political inaction in terms of regulation. You know, how well are we regulating all these fake products that are out there? And it's killing our people. It's actually stopping them from having access to the real healthcare, qualitative healthcare. Also, proliferation of quacks. You know, what are we doing about the quacks that are proliferating everywhere? So these are also things, this also boils down to political inaction.
So I'm hearing number one, political inaction. But on that note, we have to go home. Thank you so much for coming to the show, Dr.
Nice
Shalom Oni. It's been a pleasure.
Thank you very much.
Thank you for being with us there. It's always wonderful to have you on the show. Please watch the repeat broadcast. I am Mary Alale Yusuf. Have a wonderful day.